Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
And I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we're speaking with Grace Miller about long COVID. Grace is 20 years old, lives in Iowa, currently attending college where she's president of the Honor Society, hooah, and finishing up her gen eds. She plans on pursuing a degree in communication disorders and becoming a speech pathologist. Some of her hobbies include crocheting, singing, playing the piano, and learning. Hi, Grace. Thank you for taking the time to join us today.
Thanks for having me. I'm happy to be here.
Excellent.
That's great. Grace, this is Ron. We're just going to jump right into it. Could you tell us about your personal experience with COVID and long COVID?
Yeah, so I had COVID in December of 2022,
Okay.
and I thought like everyone else that I was going to be fine because I'm young and I was healthy and very active before I got COVID and stuff, but unfortunately that wasn't the case. My COVID infection had a lot of weird symptoms and stuff. I had a low-grade fever for like over a month.
Cool.
And everything kind of ramped up. So it started out with that low-grade fever and just feeling kind of sick to having like trouble breathing, chest pain, tender lymph nodes. I started getting brain fog, weak arms and legs, like I couldn't raise my arms above my head. I started getting a chronic headache that lasted for like 6 months and stuff. And I've never had a history of headaches before. They run in my family, but I was the lucky one who didn't get them before that. And I had issues like with my heart, like heart palpitations and all that. So it was not a fun infection. 10 out of 10 would not recommend it.
Aw.
But my viral infection kind of morphed into long COVID. And it's important to note that long COVID is not the same thing as like lingering symptoms, but it can start right after your infection and stuff, which it did for me. So kind of the timeline for everything and what that kind of looked like was that first month and a half or so is probably the worst, but my issues with my heart rate and I'd say my weakness started going away. And then slowly but surely, most of my other symptoms started to kind of subside, but it was still a really, really long road. I dealt with post-exertional malaise, which I still do, which is a flare-up in symptoms after even like minimal exertion that could be physical or mental. And that causes those flare-ups are what we call crashes, that they can last anywhere from about a week to a month. And stuff, and they're pretty dangerous because every time you flare up, you risk worsening your infection, or not your infection, sorry, your condition and stuff like that. So I was dealing with that, and at its worst, I would trigger a flare up from like playing the piano, just like one song and stuff. So that wasn't fun. But yeah, so I'd say by April and May, I was at my best. I could do a lot more without triggering these flare ups and stuff. I went to Ohio and went on a trip and had like no issues with that. But I'd say kind of starting in June, my health started declining again. And I don't know if it's because I got sick, which can absolutely worsen things, or if it was the onset of some other post-viral syndrome. But I'd say as of right now, the main symptoms that I really struggle with the most are fatigue that doesn't get better with sleep and stuff, brain fog, which is a term that encapsulates a lot of neurological issues or symptoms. And when that's at its worst, I struggle to carry a conversation because I can't keep track of like what I was trying to say or what I was talking about. And then one thing that people don't always hear about is worsened menstrual symptoms for women. And that's actually a pretty common thing for women with long COVID. So
yeah,
that's been my experience so far.
It sounds like it's been pretty rough.
Right. Well, autoimmune problems
are challenging.
Horrible.
Yeah.
They are actually. Yeah.
Go ahead.
Sorry. I was actually going to say, long COVID actually isn't necessarily an autoimmune disorder. It does have those properties, but the consensus on whether or not it's an autoimmune disorder is still very
still out.
Still out there. But people with long COVID, 30% of the time go on to develop an autoimmune disorder within the first 6 months, which I happen to do that. So, yeah.
Wow.
Yeah, that's rough. Grace, I know that in your bio it says that you're a college student still.
Hmm.
Are you in class or are you still remote? And when you're in class, do you still mask? I mean, I'm just wondering about reinfections now, right?
Yeah, so I still go in person because for the most part, there's some online classes that I take, but that's just because that was how I had to take them and stuff. But it absolutely does increase your risk for reinfection anytime that you really leave your house and stuff. So I do mask when I go to school and stuff, and my boyfriend also masks when he goes to school. So yeah.
Excellent. Very considerate of him. He's a
Yes.
he's a keeper. He's a
Yeah.
keeper.
He is. He is.
Oh yeah. I guess you already discussed how long. Well, no. How long did it take you to get a diagnosis of long COVID?
Yeah, so it took me probably a couple months to be told by a doctor that I have long COVID because my aunt knew someone, so my aunt knew someone, so we went and saw them. But I would say to get it officially on my chart, I didn't get it on my chart till June. But that is really uncommon for people to get a diagnosis so quickly, as most of the time when you go to a doctor, and this has happened to me before, and stuff, they just tell you, oh, you just have anxiety, you should see a therapist and stuff or you haven't gone to the gym in 6 months, so no wonder why you feel so terrible when you work out and stuff. So it can take a really long time for people to get a diagnosis.
I'm sure. And was your initial COVID infection, was it, would you consider it mild or would you consider it extreme? Were you hospitalized at all or was it pretty much like a really bad flu?
So my COVID infection does not meet the criteria for a mild infection because I had issues with breathlessness and all of those other symptoms, but I didn't need to be hospitalized, so my infection is considered to be moderate.
Okay, thank you.
So, Grace, what do you think are the biggest misconceptions that people have of long COVID?
Yeah. So I would say that the biggest misconception about long COVID is that it's fake. Boris Johnson has gotten a lot of backlash recently because he said that long COVID is fake. He used worse language, but I'm not going to say that here. But it's pretty bad that a politician has said that. But what his statement actually reflects a really commonly held attitude towards post-viral syndrome, which long COVID is a form of, basically up until recently. So we've had documentation of post-viral syndrome ever since like the 1918 influenza pandemic, that's according to Mayo Clinic. But it's been really well noted by people who have been studying it, which is a very small minority of people, and stuff, that it's been very neglected, and also people have not, like doctors and scientists have not even believed in post-viral syndrome. So with this mass disabling event that we're seeing with long COVID, it's brought about this huge boom in the amount of interest, research, and belief in long COVID. But there are still doctors out there who don't believe in long COVID, and it prevents people from getting quality care and a diagnosis.
So Grace, how common is long COVID?
So the numbers right now are that 65 million people worldwide have either had long COVID at some point or still currently have it.
Wow.
And the numbers from the CDC right now, I know that is wow. Yeah. Um, the CDC says that 8.8 million American adults have currently long COVID, and that also, I believe, is about the same number for the amount of people who have been disabled by long COVID in the US, and stuff. And I believe also from another study, they found that 360,000 children were diagnosed with long COVID in 2022. But I think to follow up that question, a good question to ask with that is who is getting long COVID? Because you can look at 8.8 million people and be like, oh, well, that's not that many people, or it might be good to know who that is. And we know that long COVID is more common in people who have been hospitalized, have an underlying health condition. If you're a woman, you're at increased risk. And interestingly, we're actually not seeing the highest rates of long COVID in the elderly community, which are the most likely to be hospitalized. And this could partly be due to like ageism in the medical field and stuff. And, you know, it's easy to say, well,
yeah,
you have issues with memory anyways. But they're actually finding that some of the most common ages are from 30 to 39 or 30 to 44, which also lines up with a sister condition, which is MECFS, or myalgic encephalomyelitis chronic fatigue syndrome. And 50% of people with long COVID go on to get diagnosis of MECFS. And that diagnosis age is actually bimodal. So they have two ranges, which is 10 to 19 and 30 to 39.
Mm-hmm.
And 80% of the time, MECFS is onset by a viral infection. So it lines up pretty well with long COVID, which is also post-viral syndrome. So, yeah.
Wow. And prior to long COVID, you were as healthy as you could be, right?
Yeah.
So,
really, yeah.
So you didn't have any of those risk factors?
I had no risk factors that would have put me at an increased risk that we know of, at least. Maybe as we come out with studies, they'll have found something, then we'll be like, oh, well, that would explain that. But
or you were just one of those lucky ones. Do you play the lottery too?
Okay. Yeah, actually, I am so unlucky. I don't know why I got this.
Yeah, right. That's a shame. Yeah. That's a shame. Right.
Stuff. Yeah, no. But yeah, I was super duper active throughout high school, and I did cheerleading my freshman year of college and worked a part-time job and did 2 choirs and went to school full time. So like I was extremely active and extremely ambitious. So yeah.
Boy, wow. Oh boy. I'm glad you got it done while you could, because right now you probably couldn't be doing that.
Well, but hopefully you'll get
back. Yeah, hopefully the next question we'll answer and you'll be.
Grace, how have you and your healthcare team chosen to treat or ameliorate your symptoms, and how are you dealing with brain fog while being in school?
That's a good question. So I have tried steroids, ivermectin and fluoxamine.
Okay.
Unfortunately, none of those worked and stuff. And that's not really surprising because we have no cure for long COVID. Mm-hmm. And then as for the prognosis rate of if I'm going to get better, it's probably a no, because I'm almost up to a year now. And after that, it kind of, you're going to stay about the same and stuff. And so, yeah, that sucks. But yeah. The other way I try to treat my long COVID right now, because I don't have an official care team, is really just pacing, which is to not trigger post-exertional malaise crashes, and you live within whatever your energy envelope is what we call it. And stuff. And then I just try to mitigate my symptoms the best I can, like eating popsicles when my temperature gets super dysregulated. So things like that. As for brain fog, my mental fatigue and stuff actually triggers my post-exertional malaise. So my brain fog gets worse when that happens. But I basically try to break up the amount of homework that I do at a time. So not studying for super long periods of time. And then I kind of just live on a prayer, I guess. Okay. I'm lucky that I can still memorize things. Like I can't always think of it off the top of my head, but if I was given a test, I would be able to recall it. But it's made things like learning music and stuff super hard. I learned 14 songs per semester for my 2 choirs, and it's been really difficult this year because I just can't remember things.
Are you aware? Are you aware? I had to see a speech therapist last year. You're going to be a speech therapist. Mm-hmm. Do you know why I saw a speech therapist?
I don't.
For my memory.
Yeah, so did I.
Oh, that's so interesting.
That is one of the goals of speech therapists, or one of the therapies, one of the treatments that speech therapists focus on. Not
that's
just.
So interesting.
I thought I was going to go because I'm waiting for dentures, and I'm going to be getting dentures. And when you talk with dentures, it sounds different. So I thought that's why my doctor was sending me there. No, it's because of my memory.
Right.
So
and they can teach you techniques.
So you should get into do a little research on that and find out.
Yeah.
What. I know what I did, but for yourself, find out what can you do.
And there are some real basic techniques that can help everyone when they can't think of something, they can't recall something. You start with the alphabet and you go through, and that can be helpful. Mm-hmm. You think of things that are associated with it. There's a bunch of steps to take that can be very helpful, and it helps people with different issues. Come up with the words or for memorization, and then you can they can also teach you new memorization techniques that are often taught to children nowadays that we never learned when we were younger.
I guess I'm just
Oh, that's really
surprised that
cool.
it comes from a speech path.
Yeah.
Yes, yes.
I mean, I've heard of all of this stuff,
It
but not from.
totally surprised
Yeah,
me too.
I had to go to speech therapy
Yeah.
as part of traumatic brain injury
And
recovery.
the other thing I was going to throw in there as a possible assistance for your energy levels, Jean and I both are taking vitamin B.
Okay.
Bravo.
This Lita is not a healthcare provider, nor does she provide healthcare advice. But she personally has
I
found
take vitamin
that
B,
vitamin B
and
can
it
be
gives me
helpful.
more energy.
Okay, but you can consult your healthcare provider and see if they have any advice.
I
But
think
I'm
we're
glad
going to
that-
hear that again later.
But it's good that it's great that you found ways to
Yes.
moderate your activity and pace it out. And hopefully
Yeah.
talking with us isn't going to.
So I actually did have a question, though, regarding the brain fog and all of that. Did you find yourself, or do you find yourself recording like any of your professors when they're giving in class? Yeah, lectures.
Or the whole class, right?
So I've just done that in the past before, but I've never really felt the need to use
Okay.
it. I just take notes during class, or a lot of mine is more book note-taking oriented. So I don't rely too much on what my professor says, or I just take notes on the slides and stuff.
Okay.
So I haven't really had to do that, but I have recorded before.
Okay.
I just haven't even used it.
And they might also, or you may find that learning in new and different ways. So maybe watching videos where they include more graphic descriptions and show graphics to help you understand a course material. So like you see it visually, you actually do it, you
yes,
hear
right.
it, you see it, you act it out. So maybe switching that up. But I think it's very interesting what you said about the influenza of 1918 and the current long COVID, how it's being dismissed. And I wonder, I mean, in 1918, you think about the end of World War I and the influenza, and I bet a lot was dismissed back then because we didn't understand it. And I do wonder how much we'll know in a year, 5 years, 10 years, because they have such a large group of individuals to work with.
Yeah.
So I personally have hope that great strides will be made, and that in 5 years, 10 years, you'll be like, I remember way back when,
Yeah.
yeah. So
I hope they take advantage of it, because I feel like a guinea pig, and I would just not want anyone, or my own kids in the future,
Right.
or anyone else's kids in the future, to go through something like this and have no answers and
Right.
stuff. This is a really terrible thing that's happened that probably could have been prevented by actually acknowledging and believing and taking advantage of research opportunities
Sure.
prior to this happening. and
Sure.
Stuff.
absolutely. And I think also a lot of times healthcare providers are hesitant to say, I don't know. And
Absolutely. Yeah. You're so right about that.
Right, that we run into that a lot. So, Grace, have there been any alternative therapies that have helped you?
you
since-
said popsicles, which is a
Right.
great alternative.
Right.
Yeah, so I kind of feel like a lizard sometimes, because I'm so sensitive to the heat. Yeah,
Okay, I was gonna
I feel a little
say,
cold-blooded. Yeah.
I thought maybe she had scales or
I
something.
thought maybe she was craving insects.
No.
Okay.
No, sorry. Yeah, no, just because that it feels a little bit like I'm cold-blooded, because when it gets hot in my house, or when it's hot outside, my body temperature increases, so I have to eat something cold to cool down, or sit in front of a fan or something. So I have a hard time regulating my body temperature. But as for alternative therapies, I haven't tried too much specifically for my long COVID. I've been interested in potentially trying ice baths and stuff. I've heard that can help some people. But I did get a massage a couple of weeks ago or so. Not specifically for my long COVID or anything. And I probably wouldn't recommend it for someone like myself, because it unfortunately did trigger my post-exertional malaise. And
wow.
it took my body a really, really long time to heal. and stuff. Obviously, there's probably something kind of going on where your body has to heal after a massage. It's normal to feel like kind of tired or achy,
Right.
but it took me a really long time. And stuff. The massage therapist was super awesome. It wasn't her or anything like that.
Right.
But I would just recommend like trying that if someone did try that, just with a lot of caution and stuff.
Okay.
Excellent.
So, Grace, what are some of the I should say, less obvious parts of your life that have been affected by having long COVID? Your routine
like you were even saying, learning new musical pieces.
Yeah, that's definitely been affected. I think socializing has been affected, not only because I can't go out and do things with people. I've actually had someone say to me, well, we can't wait around for you to get better and stuff, which I know is like terrible, and you really do learn who your friends are and stuff. But
Absolutely.
that makes it hard. People aren't super COVID conscious, so it's kind of like scary to kind of even meet up with people sometimes. I'm very fortunate to have like accommodating friends, which I'll share more about probably later, but and stuff. But yeah, I think though the most like not obvious part of my life that's been affected by long COVID is my mental health. A lot of people don't talk about the like grief that you go through when you become disabled or chronically ill, especially after having been pretty healthy your entire life, and stuff. And I was really lucky to have a therapist who pointed out to me pretty much right away that, it sounds like what happened to you, you experienced like a sudden death, but of yourself. As I lost my health, my mind, and the person that I was before long COVID in the span of 2 weeks. Like one day I was fine, and the next day I wasn't. And it felt like a really bad dream that I just couldn't wake up from and stuff. So I continue to go through this grieving process because grief doesn't really end, especially when you lose something significant, and stuff, where there are just days or weeks where I feel super sad about everything that I've lost. And I've tried to find ways to just kind of express myself in those times, or get through those really hard times and stuff.
And what brings you joy when you're at those points where everything is hard to process? Is there anything that pulls you out?
So I wouldn't say anything brings me joy in those times, unfortunately. Like when we feel sad, you just feel sad for those times. But there are things that I sometimes avoid, like especially in the first few months when I was still going through that shock period and kind of having to come to terms with the fact that I might never get better. I couldn't hear or listen to anybody else talk about the fact that they weren't getting better or how upset they were about that, because it just sent me into a really bad spiral. And stuff. So yeah.
Okay. Well, does music, when you are in a headspace for it, does music bring you joy?
Yes.
Can it still bring you joy? Okay. I mean, I understand when you're at a low point, and I shouldn't have even said pull you up, because nothing will actually do that. But okay, I'm very glad that music still brings you joy.
It does, but it's hard too, because there aren't a lot of songs out there for people who are chronically ill. And so a lot of the songs out there that are about being sad, like I have this one song that's gotten me through like a lot of my hard times in my life, but I can't listen to it in these hard times because it talks about how the pain is going to go away and this is just a chapter in your life and stuff. But for me, this is my life now.
Right.
And there's not a lot of songs out there for that and stuff. So if anybody can write songs out there, write one for people who are chronically ill, because we need those.
It's a fantastic idea.
Wonderful idea.
Yeah.
This was the best episode ever.
Oh boy.
All right. I'm putting the word. I'm putting the word out. Let me think. What's Rayanne's son's name? David.
David Sparrow.
David, we have a new song that we need you to write.
Yes. And then
in honor of your mom.
Grace can play the piano.
In honor of your mom, who just passed away from Parkinson's. Please help us. Okay, I'm going to send this to him.
We could also try putting that into ChatGPT and see what it comes up with.
Yeah, that would
be
interesting.
That's such a good idea. Yeah, I don't know if ChatGPT is ChatGPT is.
It could be Snap, where it's all music.
Anymore. Yeah, I was going to say I could text my Snapchat AI, be like, I'm sad, make me a song.
Absolutely.
That's funny.
So, Grace, what support have your family and friends offered you during this journey in healthcare?
So I have been really, really fortunate to have very supportive friends and family, which sadly we don't hear about for everyone. And there are a lot of people out there who have long COVID and their spouses think that they're just lazy or making things up. And same thing for family stuff. It can be really terrible. But I've been very fortunate. My mom is a pharmacist, and so it's really awesome to have her on my medical team and stuff because she knows so much and she can just remember so many interactions of different medications. It's so impressive, but it's really helpful to have her, and she's just been so supportive and stuff throughout this whole thing, believed me from day one, and really tried to advocate for me getting help and stuff. My boyfriend has also just been phenomenal. We just celebrated our 2-year anniversary, and he's just been there for me
Congratulations.
through.
Congrats.
Yeah, thank you. Yeah, he's just been there for me through all of this and stuff, and been by my side and stuff. And I just can't thank him enough for everything that he's done for me and just been there for me through this. And then I have really, really supportive friends, a close circle of friends that I've known since high school, and have all been super supportive. They're super accommodating and stuff. They test before we get together. If I'm feeling sick, they'll or if they're feeling sick, they won't come over, or if it's just a one-on-one thing, we'll like reschedule or like move it to online and stuff. And no one's upset about it. Everyone's like, it's just how it is, and they all really care. And then I think too, another important group to talk about is the online community, that support I've received there. I actually have a super duper good support system on TikTok, which I know we hear so many bad things about TikTok, but the chronic illness community on there is just wonderful and stuff. I was so scared during my COVID infection because I wasn't getting better, and I posted a video basically asking for help. And I received just so much love and support and was welcomed into that community with open arms. And I have so many long haulers on there to talk to that are going through the same thing to support me. And it's just really, really nice to not feel alone because I don't know anyone else around me who has long COVID, which isn't uncommon and stuff. So yeah, I've had the good support system going.
Good.
That's fantastic.
Mm-hmm.
And what advice do you have for someone who contracts COVID for the first time this winter or at any time in the near future?
Yeah.
COVID is surging. We're in a surging surge. So yeah. So I guess my first piece of advice would be not catch COVID. Because that's the only way to not get long COVID and stuff. It's on par with mono, which I didn't realize was so serious, but I actually knew someone when I was a freshman in college who got hospitalized for mono because they had their spleen enlarged and stuff, and they were out for quite a while. So COVID is on par with that. But if you were to catch COVID, I would recommend first taking a picture of your positive test in case you were to become disabled from COVID and need a disability, because they would require a physical proof of a positive COVID test.
Excellent point.
Because if you can't prove you had COVID, then how can you prove that you've been disabled by COVID, basically, and stuff, which is really stupid, but that's how it is. And then my second piece of advice is just to do anything that you possibly can to help your body fight off the infection. When you fight off a virus, it's basically like your body has become a battlefield, and your body's going to be using up a lot of resources, and there's going to be damage that's caused to your body. And we know that the only way to reduce the amount of damage to your body done by a viral infection is how fast your body can fight off that infection, and also how fast it can repair. So we don't have a lot of control over that, but we can do a few things. So that can look like trying to get your hands on antivirals. That doesn't 100% guarantee you won't get long COVID, but it can help your body fight off that infection. Even if you're not in a high-risk category, and I would recommend calling around, because I called my GP and they basically said, we only do supportive care. But when I called the university, they said, well, we would give you antivirals, but it's too late now and stuff. And then also make sure to increase your vitamin intake. Don't go over the recommended dosage, but if you don't take any vitamins, take them, continue taking them. And I would recommend vitamin C and omega-5 fats. Your brain really likes those. And then make sure to rest as much as you can, because even after your infection with COVID, because like I was saying, it's a super duper intense virus. So it's not abnormal to not bounce back as fast as you would after something like the flu or a cold.
Mm-hmm.
If you might feel tired for a while, that doesn't necessarily mean you have long COVID, but it just means your body literally just had like probably a third world war and stuff, and you need time to recover.
Okay. And you were saying that don't get COVID is a great tip. What are some of the precautions you currently take to avoid getting reinfected?
So currently I mask,
Okay.
and I wear a KN95,
Mm-hmm.
and if I'm going to be in a crowded area, I wear two.
Okay.
I also use a portable air filter, and I hold it up right by my face
Okay.
if I'm going to be eating. I usually use that in crowded areas and stuff, and then I'll just use that right by my face and stuff.
Okay. Have you seen, I think, is it Dyson that has the headphones with an air filter attached?
I had no idea that they made headphones with an air filter. That's really cool.
I think it's Dyson, but I there is a company and it looks interesting.
Like a Darth Vader?
Kind of like
you got the headset and a mask?
yeah, it's kind of, and it's like an actual air purification system. And I don't think it's as common, it's not commonly used here in the US, but in other regions of the world, it is used very commonly.
Oh, is it the ones with the heavens and then it has like a mask thing on it?
It has
And a pipe?
It's a
hose?
oh no, there is no hose. The filtration is in the unit is in the back of the head, and the mask is on the front of the head, and it's constantly providing you with purified air.
Oh, okay, I might have seen something like that. Yeah, I think I know what you're talking about now. Yes, I think I have seen
I mean,
that.
Wow.
Yeah.
it's quite an investment,
I
and
think I'm going to
Yeah.
you're gonna look
that
that
up.
up.
Looking that up.
It's kind of wild.
No, yeah,
But
but I
you-
will say, oh, sorry.
No, I want to
No.
hear from you.
I was gonna say too, I think it's important for people to know that it shouldn't just be me masking people
Mhm.
who are at a high risk of becoming disabled and stuff. If you are sick or if you have COVID and you have to leave your house, you should absolutely be wearing a mask because it absolutely reduces the rate of transmission. It's obviously not 100%. You can only ever be like 95% sure in like science, but even still, it does help. And giving COVID to someone like me would mean I would probably get to a point where I could not go to school. I wouldn't be able to get work, so I couldn't get a job, and I would be at a really, really high risk of financial insecurity. Probably have to live with my parents for quite a while, and not be a good situation. And I think that people like to think that our actions don't affect other people, but I absolutely think that if you're going out there with COVID and not taking precautions to try and reduce the spread of it, because I understand that we have to go out, unfortunately. But yeah, if you give someone COVID without trying to prevent it, I think you absolutely bear responsibility in the outcome of that person's life. It's not
Sure.
okay to do that.
Yeah, it's a community effort.
Mm-hmm.
Yeah, and I have seen posts where people with COVID, in the active case of COVID, have gotten on an airplane and weren't masking on the plane, which is kind of shocking because it's kind of like a petri dish in the air.
Yeah.
So
Yeah, that's one of the reasons why I probably won't be going on a plane for a while.
Grace, do you have any
But yeah.
any additional tips or advice for someone with long COVID?
Yeah, so my recommendation to someone who has long COVID is to first lean into those online supports that I was talking about because you're probably not going to meet a whole lot of people around you who have long COVID as well. But the online supports out there, even like Facebook is a good one because there's a lot of like support groups on there for people with long COVID or MECFS. And then my second one too is to be cautious of people who promise you some kind of a cure, even if they're a medical provider. If someone tells you, I can cure you, just be cautious because we don't have a cure for long COVID. If we did, that person would be a billionaire and have a Nobel Peace Prize.
Right.
So yeah, but this usually comes in the form online of like, oh, try my let's say
apple cider vinegar.
Try my parasite cleanse or try
Yeah.
my diet. It'll cure you. And while it's not necessarily a bad idea to try various treatments that are out there, it should be just taken with the idea that this may not cure you, but it could potentially help with your symptoms and stuff.
Right.
So my aim is not to cure myself, but at least to get my symptoms better. And then I would also recommend doing research on your condition, but also the treatments out there and the ones that are good treatments too, because unfortunately, since we've neglected post-viral syndrome, there are institutions out there who practice with like unsafe recommendations for people, or they might have just updated it but not implemented them yet, and stuff like that. And then also specialists like to brush off people who are chronically ill sometimes. So it's, you kind of do have to put together this, like a lot of people put together these binders with all of their tests and vitals and pictures of any physical symptoms, and articles on their symptoms or condition to help kind of give them something to stand on. So if you can recruit people to help you with that research or do it yourself, I would recommend doing that. And then lastly, just know that your experience is real and valid, because a lot of people will tell you that it's not. But I would just want people to know that their pain is real and your experience is real, and you do have long COVID, and I don't think you're making it up. So if you ever need to hear that, you can listen to this and know that there's someone out there who believes you.
That's wonderful.
Well, that's
Thank you,
definitely
Grace.
some excellent advice. Some great tips in there as well.
Oh, yeah.
So,
And we're looking forward to the song coming out.
Yep.
Yep.
Yeah.
so thank you, Grace, for joining us today. If our listeners want to learn more about you, how can they learn more about you?
So I have, let's see, I have an Instagram like blog-ish kind of thing. It's like Grace Miller's Long COVID Journey. You can feel free to go look me up on there. I post every once in a while, but I'm just trying to share my experience as like a student with long COVID, just to kind of give a new face to the disability and stuff. But yeah, so that's how you can learn more about
All right.
me.
Fantastic. Thank you.
Thank you.
Do
I'm
you
gonna-
ever play piano on your Instagram?
I don't play piano on my Instagram. I should though, but yeah, I do play it. I have a competition actually coming up that I'll be playing piano and singing for.
Good
it,
luck
so,
to
Good
you.
luck.
Good luck. Yeah.
Oh, that's
And
wonderful.
fun fact about that too, all of the judges are going to mask. So I was like, that's
Oh,
super
that's
awesome.
awesome.
Nice. Wonderful.
That's fantastic.
I like it when a community comes
Yeah, when they
together.
work together.
Yeah.
Thank you. If you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com. You can find us on our website, on TikTok, on Facebook and Twitter, on Pinterest and Instagram, and it's all PodcastDX. Thank you very much.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking your healthcare regime, and never disregard professional medical advice or delay in seeking because of something you've heard in this podcast. Lita is not a healthcare provider. And she cannot prescribe vitamins or anything else, but, yeah.
And I get to say, till next week.